Nanyang Technological University, Singapore, researchers have discovered that mental health chatbots can effectively engage people with depression in empathic conversations and help them treat their symptoms. Conversational agents, also known as chatbots, are computer programs that simulate human conversations. They are increasingly being used in healthcare, such as to help manage mental health conditions like depression and anxiety, as well as for general well-being. According to a 2021 survey conducted by Robot Health, one of the leading therapeutic chatbot companies in the US, 22% of adults have used a mental health chatbot, with nearly half, 47%, saying they would be interested in using one if needed. This study, conducted by doctors from NTU's Lee Kong Chian School of Medicine, is one of the first to analyze user chatbot dialogues in order to assess their effectiveness. The researchers examined 9 mental health chatbots from leading app stores, 5 of which had at least 500,000 downloads, to see if they provided self-help for people suffering from depression. The study included 9 mental health chatbots, 4 of which, Marvin, Serenity, Wobot and 7 Cups, are free to use, while Happify, Inner Hour, Wooper, Wiser and Tomo require a subscription or one-time purchase to use. The NTU research team evaluated the chatbots using scripted user personas created to represent various cultures, ages and genders. The personas also displayed behaviors indicative of varying degrees of depressive symptoms. This study, published in the peer-reviewed Journal of Affective Disorders in December, discovered that all of the chatbots engaged in empathic and non-judgmental conversations with users, as well as offered support and guidance through psychotherapeutic exercises commonly used by psychologists and counselors. The researchers discovered, through an examination of the app interfaces and their privacy policy legal statements, that all of the chatbots maintained the confidentiality of the user's personal information and did not transfer or store any of it. This includes chat history, names, and addresses, which they may reveal during chat sessions. According to the World Health Organization, depression affects more than 264 million people worldwide and is undiagnosed and untreated in half of all cases. The COVID pandemic has increased mental health concerns in Singapore, including depression. There are still many stigmas associated with mental health disorders, and the COVID pandemic has increased the number of people affected by mental health issues significantly. Healthcare systems around the world are struggling to meet the increased demand for mental health services. Individuals who are unwilling or unable to consult a healthcare provider may benefit from the use of digital health tools such as chatbots. We demonstrated how chatbots are used and how they engage in therapeutic conversations in this study. Although international research has shown that chatbots can assist people, previous studies did not evaluate chatbot user interactions. The NTU team's content analysis assessed the quality and effectiveness of the chatbot's responses, as well as their appropriateness in supporting self-management in users with depression and how they conveyed empathy to users. The researchers also observed how the chatbots guided users to engage in or complete mood-boosting activities, as well as how they monitored moods and managed suicide risks. According to the researchers, all of the chatbots have a coach-like personality that is encouraging, nurturing, and motivating. However, their research revealed that while chatbots could engage in empathic conversations with users, they could not provide personalized advice. This in-depth examination of the conversational flow may be useful in assisting app developers in the design of future chatbots. Chatbots are not yet able to provide personalized advice and do not ask enough personal questions, possibly to avoid breaching user anonymity, said first author Dr. Laura Martinego, a research fellow at LKC Medicine. However, these chatbots could still be a useful alternative for people in need, particularly those who cannot access medical care. Some people find it easier to communicate with machines than with humans. While chatbots may aid in the self-management of depression and other mental health disorders, the researcher stated that more research is needed to improve chatbots for individuals at risk of suicide and to assess the long-term effectiveness of chatbot-led mental health interventions. The researchers will conduct additional studies to broaden the scope, quality, and safety of their research into the efficacy of other digital methods for mental well-being.